Ever wondered what an anal fissure is and how it affects your health? An anal fissure, in simple terms, is a small tear in the thin, moist tissue, or mucosa, that lines the lower part of the rectum. This condition is often brought about by the passage of large or hard stools. It's not just a minor discomfort. It can impact your daily life in significant ways, causing pain and bleeding during bowel movements. Understanding what an anal fissure is the first step to recognizing its symptoms and seeking appropriate treatment. But what causes an anal fissure, you might ask? Well, these small tears in the delicate tissue of the anal canal can be prompted by a few different factors. One of the most common causes is constipation. Hard, dry stools can stretch and tear the tissue, leading to fissures. Likewise, straining during childbirth can also cause these tears due to the immense pressure exerted on the anal region. Inflammatory bowel disease is another culprit. Conditions like Crohn's disease or ulcerative colitis can lead to inflammation, which in turn may result in fissures. It's also worth noting that while anyone can get an anal fissure, they are more common in infants, who may struggle with hard stools, and middle-aged adults. Also, certain sexually transmitted infections can lead to anal fissures. As such, it's always important to maintain safe sexual practices. And let's not forget about prolonged diarrhea, which can also irritate and tear the anal tissue. While these are the common causes, remember, an anal fissure can happen to anyone regardless of age or health condition. So, stay informed and be aware of your body. It's the first step to maintaining good health. Now that we know what causes an anal fissure, how do we recognize one? It's a valid question, and the answer lies in understanding the common symptoms associated with this condition. An anal fissure typically presents with a sharp, searing pain during bowel movements. This is often the first sign that something might not be quite right. This pain can persist for hours after the bowel movement, making it a symptom that's hard to ignore. Another common symptom is the presence of bright red blood on toilet paper after wiping. This is due to the tear in the skin of the anal canal. It's important to remember, however, that rectal bleeding can also be indicative of other conditions, so it's crucial to seek medical advice if you notice this symptom. Itching in the anal area, also known as pruritus ani, is another sign of an anal fissure. This discomfort can be persistent and is often worse at night. So how are anal fissures diagnosed? A doctor can often diagnose an anal fissure through a physical exam. They may also perform a rectal exam, which involves inserting a gloved and lubricated finger into the anus. This examination allows the doctor to feel for abnormalities and assess the tightness of the anal sphincter. However, it's important to note that these symptoms can also be indicative of other conditions. Therefore, it's crucial to see a healthcare provider if you experience any of these symptoms. If you experience any of these symptoms, don't hesitate to consult with your healthcare provider. Your health is your wealth, and getting a timely diagnosis can make all the difference in effective treatment and recovery. So, you've recognized the symptoms and received a diagnosis. Now, what are the treatment options for an anal fissure? Firstly, lifestyle modifications can play a significant role in managing this condition. Increasing your fiber intake can help soften stools and reduce the strain on the anal canal. Keeping yourself well hydrated is another simple yet effective way to help ease the pain and discomfort. In addition to these lifestyle changes, topical medications can be used to help heal the fissure. These medications can help increase blood flow to the area, promoting healing and providing some pain relief. It's important to apply these medications as directed by your healthcare provider. For those with more severe or chronic fissures, surgical intervention might be necessary. A common procedure is lateral internal sphincterotomy, which involves a small incision in the anal sphincter muscle to help reduce spasms and promote healing. While this procedure has a high success rate, it's not without potential side effects. So it's important to discuss this with your healthcare provider. Remember, everyone's situation is unique, and treatment plans are individualized, depending on the severity of the fissure and the patient's overall health. So, don't hesitate to ask questions and make sure you understand all your options. Remember, it's important to follow your healthcare provider's advice for the best treatment plan. Anal fissures might sound scary, but with the right knowledge and treatment, they can be managed effectively. We've delved into what they are, how they occur, the signs to look out for, and the different strategies to treat them. With early detection and appropriate action, these painful tears can be effectively addressed. It's all about being proactive and informed. If you found this video helpful and want to stay updated on similar health-related content, remember to subscribe to our channel and hit the bell icon. Stay healthy, stay informed.